Hey everybody, Dr. Patel here. Happy Friday. Hope you all are doing well. Today I'm going to be talking about the functional spinal unit. So I've had a few patients over the course of the last couple weeks ask me to do a video to kind of talk about the spine anatomy and really my approach at treatment of the spine for anyone that's having neck pain, upper back pain, lower back pain, pain shooting down the arms, pain shooting down the legs, various different things that could be going on in the spine that could cause a lot of various different symptoms, that really are probably what some of the most common things that bother people across the nation. Well, but in order to understand the different types of treatments that are available for the spine in general, first we got to understand the spine. And I think it's important to understand the anatomy as well as the fact that there's a lot of different pieces of the puzzle when it comes to the spine. And there's a lot of different things that interact and work together when it comes to the spine as well. I have to note that, my background um, really offered me the ability to learn various different types of treatment of the spine, but it also gave me the opportunity to get a good overall understanding of how the spine is a part of the body in general. And that's something that I just want to quickly touch base on right now. So my background, for those of you that have heard this before, I apologize for being repetitive, but my background is that I'm a DO, a doctor of osteopathy, and that the philosophy that DOs learn throughout med school from day one forward is that the body is a unit and that the structure and function are interrelated. So when we think about the spine, really we talk about how does the spine move and how do the different components of that affect not only the spine, the neck, the back, etc., but also how does that affect the upper and lower limbs. Really, the spine is the centerpiece, the integral structural component that's involved with all pieces of the body altogether. So really important to look at the whole structure. When I have patients come to me with knee pain, for example, I'll examine their knee, but I also want to know how their spine is doing. Why? Because if there's a nerve that's irritated, that could be causing muscles to fire improperly, which could be causing us to put abnormal pressure into the knees. And that is something that needs to be looked at as a whole. So as a DO, we learned about what's called osteopathic manipulation to really make sure that the spine is in a correct alignment or position, make sure that the body is moving correctly. I moved on to my training as a physiatrist in physical medicine and rehabilitation, and then sports medicine and interventional pain management. And in those fields, we when it comes to pain, and particularly in pain in the spine, we started looking for what's called the pain generator, right? And that means that in an ideal world, if you have neck pain, then we want to try to pinpoint that one thing that's causing that pain. Or if you have pain shooting down your leg, we want to find that one nerve that's being pinched, that's getting irritated, that's causing the pain to go down the leg. That's called identifying the pain generator. And in some situations, it is that simple, right? If you're a young, otherwise healthy person and you have a sudden injury that causes perhaps a tear in a ligament in the neck, or if you have a sudden injury that causes a disc herniation in the low back, then that might be the single thing that's involved as a part of the picture. And addressing that single thing with particular treatments could be very, very reasonable. So for example, you may have heard me say this quite a bit, but I don't typically recommend or do epidural steroid injections. Because the truth is that an epidural steroid injection really has the best indication for a young, otherwise healthy person that has a single level disc bulge causing a single or two levels of nerve irritation. So just putting some cortisone into that area where the nerve is being irritated can calm down the nerve irritation, and then the symptoms resolve. Since that person is otherwise healthy, since there's nothing else that's going on in that area, just strengthening the core muscles with physical therapy, getting the body moving correctly, is enough for a long-term benefit. But studies show that when there's something called stenosis, or narrowing of the space where the nerve is traveling, which can be caused by a combination of things like disc bulges, arthritis, changes in the ligament structures, and things along those lines. When there's stenosis, doing an epidural steroid injection ultimately has the same benefits as doing an epidural injection of just numbing solution. So why is that? Because when you do cortisone injection to calm down the inflammation of the nerve, but there's all these other pieces of the puzzle, you're only addressing one thing or one pain generator, but not addressing the whole picture. And ultimately, that's what causes the symptoms to return long term. So that being said, when I treat a patient with any kind of neck or low back or upper back condition, more often than not, I'm not just addressing the pain generator, I'm looking at the whole functional spinal unit. But I'm going to have to push off the types of specific treatments for the spinal unit. What I need to discuss right now first is what is the functional spinal unit. So I'm going to go through a little bit of the anatomy here with this spine model. So this is a model of the spine. This is just a model of two segments, taken from the spine that goes up and down. This is particularly the low back, but it's a great little demonstration piece here. When you look at this, these squares are the vertebral bodies, the bones, and face the front of the body. This is the back of the body. This is the right side, this is the left side, this is the top, this is the bottom. In between these squares, the vertebral bodies, are the discs. The disc is like a water balloon completely filled with jelly, and I'll get more into that in a second. So the disc is in the front, providing a cushion between the two vertebral bodies. In the back, on either side, there are the facet joints, also called the Z joints. These joints are where one bone meets another bone, and that's where the motion takes place. You can kind of picture that. That's where the motion takes place between those two bones, and you have those joints on either side. In between the facet joint and the disc is where the nerves exit. And these nerves exit and go down the legs in different distributions. That's as far as the low back is concerned. In the neck, those nerves exit and go down the arms in different distributions. The nerves themselves, they exit out of the spine, but they come from this central canal. And this central canal is where all the nerves travel before they exit on either side. In the upper lumbar area, or the upper part of the low back, all the way through the upper back, all the way through the neck, all the way to the brain, the spinal cord is what actually lives in this area here. That spinal cord connects the brain to the nerves that are going to exit and go down the legs in different distributions. Okay. Now, what's not in this model is connecting bone to bone in all these various different areas are these structures called ligaments. These ligaments are supportive structures. Some people describe the ligaments like duct tape, connecting bone to bone to try to provide support. The way that I like to describe it is that these ligaments are actually like those really thick rubber bands that surround broccoli in the grocery store. So if you could picture that, those rubber bands are tight, they're strong, but there's also some elasticity to them. There's a little bit of give. And that's what these ligaments are like. And we have ligaments connecting all of our bones throughout our body. And in the spine particularly, there's a big thick ligament in the front of the spine. There's a ligament on the back of the vertebral bodies that borders the back of the discs. There's a thick ligament that connects between these bones here. And there's ligaments that connect all of these spinous processes, all of these transverse processes, all these various different structures. It's really important to discuss this because it's something that's oftentimes neglected when we talk about pain, because these aren't always the things that actually cause pain. there are circumstances where the ligaments themselves can get pulled or stretched too quickly, can get sprained, or can get torn in rare circumstances that are more traumatic, and they can become pain generators. But one thing that commonly occurs with these ligaments that's not discussed oftenly enough is that the ligaments can get stretched. And when those ligament structures get stretched in various ways, that can cause some micro instability, and that can cause various other things to take place, and I'll go into that more in detail. What's also not in this model is that we have these small little tiny muscles on either side of the spine connecting one segment to another. We have some bigger muscles that connect a couple different segments. Those are called the multifidi. Then we have these larger muscles that go across multiple segments, which are part of the paraspinal muscles. And then we have our core, the rest of our core muscles that wrap around in different directions, all the way to our abdomen and our six-pack muscles there. Okay, and that is kind of a big picture of what the whole spinal unit actually looks like. Now, going a little bit more into depth, what happens as we get older? What are the different things that could be causing pain, or can be both primarily or secondarily, directly or indirectly involved in terms of issues that take place with the spine? So first and foremost, I need to talk about the disc itself. The disc I mentioned is the shock absorber. It's that water balloon. In actuality, the consistency is more like multiple layers of rubber and then the jelly on the inside. So that multiple layers of rubber, that's called the annulus fibrosus, and the jelly on the inside, that's called the nucleus pulposus. And those are the two major components of the disc. And if you could picture that, if that disc, that multiple layers of rubber and then the jelly on the inside, if that's completely filled, that's going to be nice and cushiony. That's what the disc is like when we're teenagers or younger, right? It's nice and hydrated, nice and filled with jelly, really robust and cushiony, great shock absorber. After the ripe old age of 20 or 30, we start to get disc degeneration, which ultimately means that the disc starts to get dehydrated. There's a little bit less fluid inside the water balloon. So instead of being nice and cushiony, it starts to get a little bit more jiggly, all right? That by itself, that disc degeneration, does not necessarily equal pain. In fact, it is super common to occur and have zero pain associated with it. Unfortunately, back when MRI was created and we did our first MRIs of the low back and started noticing that these discs were looking different as we got older, this condition got labeled as degenerative disc disease. And the second we put that word disease on it, now everybody sweats the fact that we've got degenerative disc disease as we get older. But the truth is, over the age of 30, something like greater than 30% of people have degenerative disc disease or have other things going on with the discs and have zero pain associated with it. So having this degenerative disc disease is not necessarily the end of the world. In fact, it's very common. But what happens when you have some dehydration or a little bit of degeneration of the disc? Instead of that disc being nice and cushiony, if we're not paying attention to our core, if we're not stabilizing ourselves and doing the appropriate exercises, if we are, sitting with poor posture, bad ergonomics over time, or have bad lifting mechanics over time, then that disc gets wobbly and there's going to be some more friction that takes place back here with the facet joints. So what do I mean? That disc gets wobbly and there's rubbing that takes place in those joints. And ultimately, if there's rubbing that's taking place in these joints, the smooth surface of the bone called the cartilage will start to wear away, and then the bone itself will start to get a little rougher. The position of the joints will actually move as time progresses, and that actually allows for more motion to start taking place there. That rubbing away of the facet joints, that change in the bone, the roughness that occurs there, that's all called arthritis. That's your degenerative joint disease. That's your wear and tear that occurs in the low back and spine in general. And that's, again, super, super common as we get older. And again, does not necessarily equal pain, right? Same kind of story as degenerative disc disease. This degenerative joint disease does not necessarily equal pain. It's very, very common for this to occur and have zero pain associated with it. But again, if these joints are starting to change in position a little bit, there's some more wear and tear that's going on here, we run the risk of there being some extra motion that takes place there if we're not paying attention to things like our ergonomics, our posture, strengthening our core, staying away from stupid activities, things along those lines. And that's when we get into a little bit of an issue, because we start to get some irritation to certain structures, particularly when we have injuries. So what are the different things that can occur as we're getting older that can cause pain in the low back? So the disc itself can actually get injuries, right? So I mentioned the disc is like multiple layers of rubber and then jelly on the inside of that water balloon structure. If we put sudden pressure into that disc, or if we bend and twist and lift without bracing our core, if we're doing something like a deadlift or a squat and we're not paying attention to keeping our spine in a good neutral position, and we suddenly put pressure into the disc, the rubber of the balloon can actually get a tear in it. So the disc itself can get a tear in the annulus fibrosus, or that rubber part of the rubber balloon, and that tear can actually be significantly painful. Not only can that tear be significantly painful, but what oftentimes occurs in this situation is that the tear causes such quick, immense pain that the body freaks out. The muscles throughout the back part of the spine actually are like, holy crap, that disc got injured. We're gonna tighten up in order to try to take pressure off of that disc. So the muscles spasm, clamp down, tighten up, and that ends up causing pain as well. So if you ever have your back go out, then more often than not, it's an injury to the disc that then causes the muscles to spasm and tighten up. If you go to the emergency room, or if you go to your primary care doctor, more often than not, they'll say, oh, it's a strain of your muscles, or it's a pulled muscle in your low back. But these are really strong muscles that keep you upright all of your life. With the exception of major traumas like a car accident or something, where you have a major fall, or really something violent, it's uncommon to actually tear or rip or strain the muscles of our low back. They're really strong, robust muscles. In actuality, what's happening is those muscles are freaking out because of something else that's going on. Even the disc is actually a strong, robust structure, and people are able to do heavy amounts of deadlifts, weightlifting, bending, picking up things, and not injure the disc. So I don't want to make it sound like it's that easy to injure the disc, but if we put ourselves in awkward positions, then it is easier to cause an injury if we're not paying attention to the way our bodies are moving. But even a disc tear does not necessarily equal pain, but when it suddenly occurs, this is the type of thing that can cause your back to go out. The disc itself, what are other things that can occur with the disc? The disc can actually bulge outwards. You may have heard of a disc bulge, or a disc herniation, or a slipped disc, or things along those lines. Remember, the disc is a water balloon. So if you put pressure on one side of a balloon, what's going to happen? It's going to bulge out the other way. So it's very common for us to have disc bulges. But again, just because we have a disc bulge doesn't mean that it's going to cause pain. Very, very common. Disc bulges can be even very, very large and have no associated symptoms along with it. Now, when we have a disc bulge, it's actually not typically the disc itself that's painful, although a very large disc bulge can also have associated tears, which can cause pain. But more commonly, the disc bulges, and when it bulges outwards, it irritates the nerves. These nerves are the electrical wiring that transmits signals up from our brain all the way down to our limbs. And they are in charge of various different things. Nerve irritation comes in three flavors. Number one, nerve irritation can cause pain. And that doesn't necessarily have to be pain in the back. It could be pain going into the hip, into the buttock. It could be pain going down the leg, down the thigh, down the calf, and even into the foot. I have seen patients that had purely only bottom of the foot pain or purely pain in that big toe and actually have it being associated with nerve irritation in the low back. They had zero back pain, but they had pain in their foot associated with nerve irritation in the back, and that is not uncommon. But the typical thing that people think about when they think of nerve irritation is sciatica, or the pain that shoots down into their buttock or down their leg. But that's number one. Number two, nerve irritation can cause numbness or tingling. Numbness, like you can't feel in your leg, or tingling, like pins and needles. And the same type of thing could be felt in the arm if we're talking about nerve irritation in the neck. And then number three is weakness. Now, on an extreme, the nerves being irritated can actually cause us to have significant weakness, like a foot drop, like you can't lift your foot up, or dragging your toes, or even your leg buckling. But weakness could be more subtle than that. The nerves are the electrical wiring that go to our muscles, which are our appliances. So if the electrical wiring is not working properly, the muscle won't work properly, right? But it doesn't have to be like an on-off switch. That's if the nerve is significantly damaged. If it's just irritated a little bit, the muscle just can be firing abnormally or not firing optimally. If you ever walk into a room with the light flickering above you, my patients may have heard this example already, but if the light's flickering above you, that problem is not necessarily associated with the light bulb or the muscle. It may be associated with the electrical wiring going to the muscle. And we can flip the switch as much as we want to or try to tell our muscle to fire correctly, but that light ain't going to turn on correctly, right? So the point of this is that we can have some subtle weakness that could be a sign of nerve irritation. And that's the type of thing that could lead to our knee bothering us, or our foot bothering us, or our hip bothering us, even in the absence of other symptoms that are signs of something going on in the low back. So we talked about the disc itself being a potential pain generator. Now we're talking about the nerve potentially being a pain generator associated with the disc bulging out and pressing on the nerve. But what else can cause irritation to the nerve? If the disc is bulging, that can narrow the space where the nerve is traveling. If the facet joint has arthritis and the bone is actually getting larger, things like bone spurs that occur with arthritis, if that bone is getting larger here, then that can also narrow the space where the nerve is traveling. And finally, the ligament structures, if those ligaments are getting stretched and they're getting looser, some of these ligaments can get thicker, they can actually kink down on each other, and again, also narrow the space where the nerves are traveling. This narrowing of the space where the nerves are traveling is called stenosis. There's two types of stenosis broadly. There's the stenosis that involves the central canal of where the nerves are traveling in general, or there's the stenosis of the foramina or the hole where the nerve is exiting out of. And again, that stenosis can be caused by disc bulging, arthritis, ligament laxity. It could be caused by multiple things or a combination of things to cause that. Now, and then finally, when we talk about non-nerve related pain in the back itself, the pain can come from the facet joints. If those facet joints are starting to develop arthritis, or if we're putting abnormal pressure into those joints, for example, if we've had a history of a disc injury years ago, and now our body is used to taking pressure off of the disc, so we're constantly arcing backwards, we could be constantly pressing on those facet joints and causing irritation over time. Those facet joints can become pain generators if we're not putting correct, pressure into them. So those are kind of broadly the different types of things that can cause pain within the back, the different pain generators. The disc itself, disc bulging causing nerve irritation, stenosis or narrowing of where the nerve is traveling to cause nerve irritation, the facet joints, the muscles, and the ligaments. Now those are the things that potentially can cause pain, but are they involved with the picture when whether or not they're causing pain? Now that's the important question, because if we have a disc bulge here, and if we have loose ligaments back here, then it may be easier for us to put pressure into the disc because the ligaments aren't being supportive. Similarly, if the muscles are spasming back here and causing pressure onto the facet joints, now we might have the facet joints and the muscles as a part of the picture, right? Oftentimes when we try to identify the pain generator, we see, what motion is irritating you, what motion is actually causing the pain, right? If you're bending forward, therefore you're putting pressure on the front of the disc, causing the disc to bulge outwards at these nerves, and if that causes pain, then okay, maybe we could say the disc is the bigger issue. Whereas when you're bending forward, you're actually taking pressure off of the facet joints. When you're bending backwards, you're taking pressure off of the disc, but then you're putting pressure onto the facet joints, right? So in an ideal world, in the most simplistic, ideal way, we'd love to say, okay, your pain is only with bending forward or only with bending backwards. But oftentimes there's components of things that occur in multiple directions. And that's why it's very common for us to have multiple different pieces of the puzzle when it comes to the spine. So, all in all, the moral of the story is that there's a lot of animals in the zoo. And again, this is another example that I've used with my patients in the past, that let's say your pain generator is your lion. If we just tried to tame the lion, but we still had your monkeys and your hyenas yipping and yapping and making noise, the lion's gonna get angry again. Or shoot, you might get annoyed at those monkeys, right? But the fact is that there's a lot of animals in the zoo, and we need to try to tame as many of those animals as possible in order to try to get the best benefit in most situations. So when we talk about the functional spinal unit, we're talking about all of those components, right? We're talking about the discs, we're talking about the nerves, we're talking about the joints, we're talking about the muscles, we're talking about the ligaments. All of those things actually work in concert together, and that's why we need to address all pieces of the puzzle when we're addressing the spine. I hope that all made sense. Really, it's fundamental. It's really important to understand our bodies when we're in pain, when we're trying to seek out treatment. If somebody says that, okay, that's the thing that's causing the pain and that's what I'm going to be attacking, we always have to take a step back and say, all right, what are all the different things that I can do to make that treatment optimal? Are there other components that we may need to address, whether now or in the future? And what's the most comprehensive way in which we can address it? So, next time what I'll do is I'll talk a little bit more about my strategy in treating that whole functional spinal unit. What are the different types of treatments we can do, both in traditional care of pain management and also the more functional approach in terms of what I do. One of the tools that I use most prominently in the treatment of the spine is exercise, physical therapy, manual manipulation, all of which to make sure the body is moving correctly. And then the other big tool that I use for the spine is specific guided injections of orthobiologics, a patient's own blood growth factors, bone marrow stem cells, even in certain circumstances, some microfragmented adipose fat tissue. There's various different things that could be used to treat various different components, and I'll do an overview of kind of how I approach the functional spinal unit when somebody has neck, upper, or lower back pain. looking forward to also, maybe not next time because it is going to be a few weeks of holidays going on right now, but I do plan on bringing in some guests to talk about their strategies, their experience, and the data that supports the various different type of treatments that I'm going to be talking about. So stay tuned, and keep your eyes out for our messages on Facebook, our emails if you're part of my patient group. If you're interested in getting emails from us about our newsletters and updates on Facebook Live and things along those lines, please email us at info@fxregencenter.com. If you liked this video, if you found this helpful, please share it. Please like it, share it. Tell your friends, tell your family, tell your foes if you still care for their well-being, and spread the word. If you have any questions, please feel free to comment, DM, or again, contact us at info@fxregencenter.com. This has been Dr. Patel. Have a great rest of your Friday and a happy, happy weekend. Talk to you guys soon.